Hi, I'm Katie Stewart, Director of Healthcare Ratings at the Leapfrog Group, and I'm here with Dr. Jason Kanos, Chairman of Obstetrics and Gynecology at Holy Name Medical Center, to talk about their impressive work improving maternity care outcomes. Welcome, Dr. Kanos.
Thank you.
So your hospital won the top poster award at the 2024 Leapfrog annual meeting last year for your impressive outcomes in improving C-sections and episiotomies. Can you tell us more about that work?
Sure. We're happy to get the acknowledgement from Leapfrog and very thankful that you had recognized us and that we were able to attend the meeting and present the data. Uh, a few years ago, Holy Name had a quite high NTSV rate and episiotomy rate. I think we were at around 33% for the NTSV rate, and the episiotomy rate was approaching 10%. I started here as chairman about a year and a half ago, and that was one of our goals, was to put some measures in place to lower the NTSV rate and lower the episiotomy rate. And we did that in a very deliberate and systematic fashion, mainly doing reviews of those cases. We created an NTSV committee that had physicians and nurses on it, as well as the perinatal safety nurse that reviewed that committee, that reviewed the NTSV and provided that feedback to our providers and the nurses that were involved. We started a laborist program, and we're happy to report that next month we'll have almost full coverage for the laborist. And I think, that has been proven in other studies to help improve quality metrics and namely lower the NTSV and the episiotomy rate. I'm a big believer in transparency of numbers, and we discussed the NTSV rates and the episiotomy rates at our safety rounds on labor and delivery. We discussed them at monthly department meetings and monthly OBQI meetings. And we also sent out report cards to our physicians on a quarterly basis that include their metrics and compared them to the goals, right, or the standards of the Joint Commission and also the departmental numbers. So we did a lot of work, and we did it in a deliberate but gentle fashion, I would say. We didn't push it sort of all at once.
Yeah, that's really impressive. It's great to hear the transparency that was involved and, sharing those numbers, not just at the department level, but also at the individual level. So that's great to hear. Can you tell me a little bit more about the laborist program for those that might not be as familiar with that concept?
Well, I mean, a lot of hospitals now using laborists to cover their inpatient OBGYN services. And, laborists are board certified, experienced OBGYNs that have an interest just in doing hospital work, namely covering labor and delivery. There's even extra training, although it's not an approved fellowship, but there is extra training beyond residency for those physicians that want to do more sort of post-residency training to be laborist. So it's what I was used to at the institution where I came from, and that was one of the goals that we were going to use when we started here, and also use midwives in the hospital as well as covering the floor in addition to the laborist. So they do essentially shift work, either a 12-hour shift or a 24-hour shift, and they're committed to doing a certain number of shifts per month as part of their contract. They work together as a team. They do proper sign out in the morning. They're attending safety rounds. They're essentially running the floor. Mm-hmm. And although they're not doing the majority of the deliveries, they're doing a fair number of the deliveries at Holy Name.
That's great to hear that you've had success with that. Leapfrog also asks about, services like the use of midwives. So that's great to hear. When did you touched a little bit on this, but when did your maternity care quality journey begin as a hospital, and what really spurred it?
Well, I mean, it probably started from the beginning, right?
Mhm.
Even before I certainly came here, I think they had a good foundation for quality on the maternity side, you know, and the GYN surgical side as well. So Holy Name is looking to grow and expand their
Mhm.
services. We're now have had medical students on our floor. You know, that's been happening for over a year. We're hoping to start a residency program, not only in OBGYN, but some other services as well. So as part of that, you have to have accountability, right? And
Mhm.
you have to have a quality program. So I think the efforts towards lowering the C-section rate and the episiotomy rate and some other quality measures, you know, probably started a year and a half ago, you know, when the new leadership team started.
Yeah, are there challenges that still kind of persist? I'm sure there are. Obviously, your poster highlights some great success in meeting the Leapfrog standards now, but what challenges still persist?
I mean, every day there's a challenge, it's part of the job, and I think it's understanding those challenges that will come. Some will be known and some will be unknown, and how you sort of handle them. It's not a straight linear curve to success, right? You have ups and downs, and you know, we've seen that lately with our NTSV rate, and in part that's related to personnel changes. You know, you lose part of your team for whatever reason. You lose some nursing leadership. You lose some physicians, and you have new people coming in. So the culture is very fluid, very dynamic. It changes, and you have to sort of ride that wave and figure it out. So I think that change is one of our biggest challenges. And
Mm.
also, you know, not everybody agrees to the same plan that you agreed to or that the team agrees to. So you could talk about the importance of lowering your C-section rate and your episiotomy rate and trying to improve your quality measures, but it's understood that not everybody's going to agree with that plan. So it's been a challenge at trying to get everybody on the same team, you know, with that same perspective. But
Mhm.
you know, that's a slow process. It takes years to change a culture in the healthcare system. And not that the culture was bad, because it certainly wasn't, but you know, we were looking to improve some areas. So many challenges, yes.
How do you go about cultivating that culture of safety, especially with those personnel changes that you mentioned?
You know, it's important to understand that it's a team effort, right?
Mhm.
And it's not just the obstetrician, it's not the physician that needs to lead that charge. It's really every member of the team. And that includes our nursing staff, that includes nursing leadership, it includes our anesthesiologist and the pediatricians. It includes, you know, even the you know, administrative team and our quality team and people that may not directly get involved with patient care, you know, the clerks on the floor. I mean, it's really understanding that you need everybody kind of on board, or at least trying to understand what the issues are. So I think that's something I learned a long time ago. It's really important to understand that it's a team effort, and getting that team together and to understand the issues is really, you know, it's a long process. So, and you have to be
Certainly.
patient, and you have to understand, you know, there's ups and downs, and um, you know, you have to be determined, and you'll get there, but you want to use proven scientific measures, which we have. You
Mhm.
know, these measures that we use at Holy Name, it's not something we invented. It's something that comes from, you know, some other larger institutions that have proven success with lowering the NTSV and episiotomy rate. So
Mhm.
I think No, it's a large endeavor.
Mhm. Certainly.
Yeah.
And your poster and our conversation today touches on, recognizing that you reported to Leapfrog, you were not meeting the standards for these measures, C-sections and episiotomies. What motivates, Holy Name Medical Center to participate in the survey? We know that that's a big undertaking, getting everyone on board with those metrics and reporting on them. What's the motivation behind that?
Well, it's patient care. I mean,
Mhm.
you want to provide good quality, modern patient care, so patients have good outcomes and are satisfied with their care that they're provided. And I think having a organization like Leapfrog and participating in that helps you with that and trying to improve patient care. Not only makes you accountable, set some standards, allows you to compare some of that data with some other institutions, but it really helps with patient care.
Mhm. Yeah, thank you. Accountability is key. And you mentioned also, getting everyone to buy into kind of your plan, right? Everyone on your plan. So, how do you engage staff and leadership in meeting these standards to make sure that they're on board with lowering that NTSB C-section rate or that episiotomy rate, for example?
Well, it's not my plan, right? I mean, it is a team plan
Mhm.
from nursing leadership, and so you get perhaps a smaller group to decide that this is the way that we're going to proceed forward. And then you have to present that information in a systematic and scientific way to say that, it's just not my opinion, but really this works in some institutions, and in my experience, it's worked. And I think you have to do it in a pleasant way and not push it down people's throats, and you have to respect the principles of just culture and not to sort of point the finger and start blaming everybody and telling them that all their C-sections were wrong and this is why.
Mhm.
That's not the approach. So I think it's doing all of that in a slow, patient process. And then once you start to have results, people are like, hey, maybe they know what they're doing. So, and I think that helps a lot. And I think the leapfrog recognition has helped a lot in showing Holy Name that the measures that we have done have really made a difference and can make a difference.
Yeah, that's great. We were very happy to recognize your efforts in these areas. So, what advice do you have for other hospitals that are interested in improving their maternity outcomes and participating in the survey?
I think you have to start, right? So I think you have to
Mhm.
join Leapfrog or a similar group. I think you have to be open to that transparency with a national organization. I think you have to look at what other hospitals have done that have had success and see what aspects of that program could be applied to your own program. Because just because we did it at Holy Name, doesn't mean that you could go to a different hospital and do the same thing and have the same result. I think you have to figure out what you think would work at your program. Um, so I think that's the advice. And then understand it's a slow process to change culture in a
Mhm.
hospital, and that's okay. It doesn't all have to be done, within the first, year that you start something. So don't give up, keep going. And eventually, I think if you're systematic about it, you'll see some success.
Yeah, that's great advice. Anything else that we haven't touched on about your journey and your improvements in these areas?
I think we, I think we've done it. I want to thank Leapfrog. I want to thank you for recognizing us and, realizing the importance of getting this information out there. And I certainly want to thank my team that's worked with us, the nursing leadership and our quality team members that have helped with this project. So, but
Well, thank you. It's been a pleasure to speak with you and to recognize your efforts, and congrats to you and your team.
Thank you. Thank you so much.